29 states, including Telangana, 2,116 languages, 4,600 castes, 4 union territories, 29 major festivals, 52 tribes, 6 religions, 6 ethnic groups, 6,60,000 villages, 125 crores of people, and one nation, India. India is a fascinating country in the world and the largest democracy in the world also. In this great country of ours, we have people who feel for the poor people and the concerns of rural villages. Friends, we have with us today Dr. N. Sridhar Shetty, the founder dean of A.B. Shetty Dental College, which started in Mangalore in the year of 1985. Dr. N. Sridhar Shetty, after his degree, had the idea of going abroad, but suddenly he felt, I shouldn't be one among all those who go to America, England, and other countries. He felt that I should serve my own country. Such a patriotic feelings originated in his mind, and Dr. Sridhar Shetty has so many dreams to help the rural people with their dental problems and other health problems. Dr. Sridhar Shetty is a dreamer. Not only that, he has successfully administered a dental college, the first ever in Dakshina Kannada, and he felt that patients are far away in villages and they suffer, and we must reach them as quickly as possible instead of they suffer. With that idea in his mind to spread out medical services to the roots of villages, he has come up with novel ideas. Welcome, sir, to Global TV special interview session. Madam, you are also welcome to this session. First of all, I would like to ask you one question. Hailing from Dakshina Kannada, you have such patriotic feeling for your country. Do you think it is possible with the present mindset of the young doctors that they are coming out to convince them that their service is required in rural villages? Do you think it is possible?
Yes, many of us who are graduated from the different medical colleges, dental colleges, at least 10% of the people may have the same feeling like me that we have to go to the rural people. But the circumstances and the infrastructures, facilities, support which we get, it is not support from the government I am talking about. Support from the public in the rural areas is not that welcoming, and it's always discouraging. As a young doctor qualified in post-graduation, if he goes and to a small place and starts practice, even if he does a subsidized treatment for the patients, after spending a lot of money on education, spending a lot of money on establishing a good small hospital, even if he has to practice there and serve, the first and foremost thing is that the local people, their economy is not that great. Even affordable people also, they will go to a doctor only when they are handicapped to walk, handicapped to work. Till then, they say, okay, I'm all right, they will take this medicine, that medicine, and what would be the fate of a poor man who has to earn his bread every day. Now, even if he does a subsidized treatment, it is not possible for a doctor to bring up his family. He has become a doctor, he would like to have his children doctors or engineers or something in their life. So it is not possible for him to have a good life. Because if he has to put one son or a daughter in a city, apart from paying the tuition fees and other things, he has to pay hostel fees. The government should support all these doctors. They should give income tax free, hardship allowance.
Kindly highlight the contents of the new book that you have published, sir.
I have made one project, what is known as institutionalized approach to the semi-urban and rural area at their doorstep.
Okay.
At free of cost. Man, this is my project. Now, since I am not a medical man, I feel that it can be done even in a medical colleges by changing the certain statute requirement of the government, the statute bodies, where they say you have to be in one campus, you have to gather this, that and all. There are so many regulations they have put it.
Yes,
I'm not saying that regulation is bad, but to suit our country, so that people, specialists who are there all in the medical colleges, infrastructures, best of infrastructure, best of this one, plus the students are there who are going to be a doctor, big manpower. So if this manpower is fragmented and put as a 5 hospitals in the different areas,
Okay.
and fixing a target of at least 50,000 families of the rural areas for simple bandage to the even to the cardiac surgery is their responsibility, and give them a free treatment. Don't care whether he's rich or poor. The rural people, because rural people are very important for us. Our revolutionary laws, regulations, so many things are made. A rural, it is a place where we get our food. Today people are
Sir,
not
if
growing food.
if your dream becomes a reality, it will be Ramarajya. Haves and have-nots.
Yes.
The concept going to help the one who needs.
Yeah.
So this concept of yours to spread the medical service to rural areas so that the poor, the needy gets the benefit.
Yeah.
And at this juncture, I also feel that the present mentality of fresh doctors who come out, they have one thought that they can't live in rural areas.
They can't make a quick money.
Probably. That also would be one of the major reasons. Making quick buck is also there in medical field. With your novel strategy, ideas to take the medical service to villages, internship doctors, they also need rural service. They can be easily, their services can be easily involved in your strategy.
We have developed for every disease a doctor, a specialist, every organ a specialist.
Yes, yes.
Now these interns will be an assistance to them. They will learn along with them. We want more and more specialists to go to the villages. A village person who is sick, who is going to take him to the big hospitals? What I am saying is that we should go to them, find out who is sick, create an awareness for them, bring them, treat them and put them back.
Sir, to realize all these dreams that you have, it requires money. Where do you think money can come from?
Today we have so many teaching institutions. I said there are 647 districts in this country. There are 349 medical colleges in this country. Among their regulations, instead of they living in one camp, put them to the different camps.
Yes.
Create more and more hospitals and send students, specialists to those hospitals. Let the students and specialists visit through the community health department. Each village, that is, I said, they should take about 50,000 families. They should take in it as a target for them. And it is, so he should streamline and give them an idea through the public relation officer, hale and healthy. At the same time, I also have introduced one more thing that, see, for health, it is physical, mental and economic. They should make a team along with an agriculture officer, horticulture officer, veterinary officer, public health engineer and public relation officers. Then you will say, where is the fund? Now, today in our country, as I read, as I see in the news, there are a lot of funds are diverted for this type of purposes. We should not be a middleman. We are an agency to show them a market, to get a good price. At the same time, they can contact in a big companies and you get a job for them. Just like, you're tying beadies today is happening. So this type, you can improve the economy of the people. When we talk as a doctor, going to be a doctors, young doctors, they will be very, very aggressive. They will talk very convincingly and they will impress the public. That's why I want the students also to go along with the doctor with the prepared questionnaires to house, house to house. Then we are also using these young doctors, interns or postgraduates or anybody to make a street place, health street place. They have to write their own scripts, the songs, everything. There is no expenditure for street place. You have to just go and clap and talk. And We have done so many street plays around Mangalore even up to North Canara and all. And we have gone to only small places. We have not gone to big cities. Small places. So this has created a lot of awareness for the people for health. The most important thing is we have to create an awareness for the people. Institutions should create an insurance. Insurance. And from everything it should be free. I know how to recover the money, all I have told, and how to raise funds. We are collecting university fees, sports fees, library fees, all fees which is related to students studying in the college. But in any medical college, the most important thing is clinics. Laboratory fees you are collecting. Why not clinical fees? There are so many fees we are collecting. Now why not clinical fees? You collect clinical fees.
Government should intervene here where there is a need in rural areas to serve the sufferers.
In each district, put a responsibility of 50,000 families in the rural area to that college. That is their responsibility. There should be a punitive clause for the reasons of negligence of creating an awareness and treating. The authorities should punish that. Punish in the sense they are not putting them in jail. And then you also should give a support for these people who are starting a colleges in the rural area. Their buildings or anything which they are putting up in the rural area, it should not be taxed. The land you buy, it should be tax-free registration fees. No, I'm just telling how the government can support. Plus, people who are working there also, they should be given, as an incentive for the doctors to go to the villages, it should be income tax-free salary. They should give hardship allowances, education allowances, and all those allowances for those doctors.
Government should lavishly invest in rural medical services. Only then rural people will find doctors.
They said tertiary healthcare, secondary healthcare, and then primary healthcare. Where are these tertiary healthcare? Only in 55 cities in this country who are having more than 10 million population. By name I have put what are the cities which are there. And it is not there in remaining semi-urban areas and the villages. It is possible if you make a medical college compulsory to have these hospitals in a smaller and smaller places, make a plans to create an awareness to the people, give them an accessibility, availability, and treat them free, because there is no question of affordability there.
Dr. Sridhar Shetty, with his vision of extending medical service to rural areas, shall come true, and hope the government will look into your project, and then there shall be a revolution as far as rural medical health care is concerned. May all your dreams come true, sir. Thank you very much for sparing your time to give an interview for Global TV. Thank you.
Thank you.
Thank you, madam.